Hello everyone, welcome to your Health Oasis. Today's topic of discussion is acute conjunctivitis. So, acute conjunctivitis, also called as pink eye, is the inflammation of the transparent membrane that lines the eyelids and eyeballs called conjunctiva. Before going into the details of conjunctivitis, let us very briefly discuss the anatomy of conjunctiva. Conjunctiva is made up of three parts. Bulbar conjunctiva, which is the covering of the eyeball and protects the white of our eye. Palpebral conjunctiva, which is the lining of the eyelids. And conjunctiva fornix is the piece where the bulbar and palpebral conjunctiva meet. The functions of conjunctiva include protection. It protects the cornea from grit and things that can cause scratches. Lubrication. The tear film allows the eyelid to open and shut smoothly without irritation. We also have production of tears and clear vision. Together, the layers of fluids create a smooth optical surface that you need for good and non-distorted vision. Causes of acute conjunctivitis include infectious causes and non-infectious causes. The infectious causes are viral and bacterial causes. Non-infectious causes include allergies, any kind of chemical exposure or accidental fall of chemicals into the eye, mechanical trauma, or injury. Now, among all the causes, viral conjunctivitis accounts to 80% of all cases of conjunctivitis. Let us now go through the signs and symptoms, the common and distinguishing features of allergic, bacterial, and viral conjunctivitis in detail. Allergic conjunctivitis is an inflammatory response of the conjunctiva to an allergen. In response to an allergen exposure, like pollen, the body produces an antibody called immunoglobulin E, which triggers the special cells in the mucous linings of the eyes and airways to release inflammatory substances, including histamines, and the release of histamines in turn produces many symptoms, one of which may be pink eye. There is bilateral eye affection, which means both the eyes are usually affected. There is conjunctival injection, which means there is dilatation of the blood vessels of the conjunctiva. There are associated upper respiratory tract symptoms like runny nose, sneezing, etc., as allergic conjunctivitis is a part of larger systemic atopic reaction. Other symptoms include intense itching, which is a very peculiar characteristic feature seen in allergic conjunctivitis. Teary eyes, that is, the discharge coming from the eyes may be clear or watery and is also called as mucoserous discharge. There may be burning of the eyes. Chemosis or swelling of the conjunctiva, as you can see in the image alongside again, is a very peculiar sign of allergic conjunctivitis. The person having allergic conjunctivitis almost always gives a history of allergies. Let us now go through the characteristic features of bacterial conjunctivitis. The affection may be unilateral or bilateral. That means most of the times we see one eye getting affected, but both the eyes can be affected as well. There is redness and conjunctival injection, which is similar to that we saw in allergic conjunctivitis. Itching is present, but is not as troublesome as seen in allergic conjunctivitis. The discharge of bacterial conjunctivitis is green, yellow, and purulent, which is the hallmark sign of bacterial conjunctivitis. Remember, the discharge we talked in allergic conjunctivitis was clear, watery, called as mucoserous discharge, and that in bacterial conjunctivitis is yellow, green, purulent discharge. Gluing of the eyelids due to the crusting of the discharge over the eyes is again a very peculiar symptom seen in bacterial conjunctivitis. This happens because the discharge hardens and forms a crust over the eyes while sleeping at night, which makes the eyelids glued together in the morning and we face difficulty in opening the eyelids. Now let us go through the signs and symptoms of viral conjunctivitis. Again, the affection could be unilateral or bilateral, as we saw in bacterial conjunctivitis. Itching and tearing of the eyes may be present but less prominent than what we see in allergic conjunctivitis. Gritty or foreign body sensation in the eye is a hallmark symptom of viral conjunctivitis. The person may feel that there is something stuck inside the eye, or there may be a sand like sensation in the eye. So, this is a very, very peculiar symptom of viral conjunctivitis. The discharge from the eyes in viral conjunctivitis could be watery or serous, somewhere similar to what we saw in allergic conjunctivitis. Gluing of the eyelids in the morning is present but is not as severe as that in bacterial conjunctivitis. Pain or irritation of the eyes could be an associated symptom present in viral conjunctivitis. Viral conjunctivitis could be associated with any kind of viral upper respiratory tract infection like common cold, sinus infection, etc. Now, one very important thing we must remember is both viral and bacterial conjunctivitis are highly contagious and can be spread by the liquid that drains from the eyes of an infected person. For example, the person who is infected touches the eye and then touches any object around you, and you unknowingly get into contact with that object and again touch your eyes. So, in that way, the infection can spread from one person to another. But allergic conjunctivitis is not contagious as it is a result of one's own body's immune response. Now, let us go through the home remedies and self care measures you can take to get rid of conjunctivitis faster. Stop wearing contact lenses and make sure that you use a new pair of contact lenses once the infection subsides. Stop wearing eye makeup and again try using a new set of eye makeup after the infection settles in order to avoid recurrent infection. For bacterial conjunctivitis, use a warm compress over the eyes. You can soak a clean cloth in warm water and lay the damp cloth over your eyes and leave it in place until it cools. Repeat this several times a day or as often as is comfortable. Use a clean cloth each time so that you don't spread the infection. Use a different cloth for each eye if you have the infection in both the eyes. For viral or allergic conjunctivitis, a cold compress would be more helpful. You must remember, viral conjunctivitis is self-limiting like all other viral infections and does not need any treatment most of the time. And we also know that there is no definitive treatment available. For allergic conjunctivitis, you must be able to identify the allergic trigger and treat the same in order to get rid of the infection faster. Avoid touching your eyes frequently and also avoid frequent rubbing of the eyes as it may worsen the symptoms. You may use over the counter sterile saline or teardrops to keep your eyes moist. Make sure to change the pillow covers and use a clean towel daily. Do not share anything that touches your eyes with your family members or anybody who comes in contact with you. You must also be aware of the red flag symptoms where you must not wait and waste time but immediately reach out to your doctor. You should immediately meet your doctor if you develop blurry vision or any kind of vision changes. If you have severe pain in the eyes, you develop photophobia, which is also called as light sensitivity. If you have symptoms that are continuing for more than 1 week, and you develop new symptoms like systemic symptoms like fever, chills, headache, body ache, etc. Do consider to like, share, and subscribe to the channel if the topic was useful to you. Follow me on Instagram for more such helpful medical topics. Thank you.